Hello everyone, welcome to Florida Aesthetics. In today's lesson, we'll begin Chapter 4, Disorders and Diseases of the Skin, based on the Milady Standard Esthetics textbook. This is part 1 of the chapter, where we'll explore skin lesions, acne, rosacea, Talngiectasia, and varicose veins. Understanding these conditions is essential for every esthetician because accurate recognition helps provide safe, professional, and appropriate care. So let's get started. Today we're starting with the basics. What do we mean by a skin disorder or disease? Simply put, it's any change in the skin's normal look or function. Some are short-term, others last longer, and they range from mild to more serious. As esthetician, our job is to recognize what we see, understand our limits, and refer to a medical professional when needed. Understanding skin disorders is one of the most important responsibilities of an esthetician. Early recognition helps protect your client's health and safety and allows you to provide care within your professional scope of practice. As estheticians, we do not diagnose or treat medical conditions. Our role is to recognize abnormal skin changes, perform appropriate skincare treatments, and refer clients to a dermatologist whenever a medical condition is suspected. A dermatologist is a medical doctor who diagnoses and treats skin diseases, prescribes medications, and performs medical procedures. Knowing the difference between these two roles is essential for providing safe, ethical, and professional care. Let's start with primary skin lesions. These are the first visible changes that appear on the skin before they are affected by external factors. These early changes can give us important clues about what's happening in the skin. Recognizing them early is not about making a diagnosis, but about knowing when it's safe to perform a treatment and when a client should be referred to a medical professional. Now, let's take a closer look at the most common primary skin lesions. Let's continue with the remaining primary skin lesions. A vesicle is a small blister filled with clear fluid. A bulla looks similar but it's larger. A pustule contains pus instead of clear fluid. A cyst is a closed sac beneath the skin that contains fluid or other material. Finally, a tumor is an abnormal growth that can be either benign or malignant. Now, let's move on to secondary skin lesions. Unlike primary lesions, these develop as primary lesions, change over time, or as a result of scratching, infection, or other trauma to the skin. Recognizing secondary lesions help us understand the stage and progression of a skin condition and guides us in providing safe and appropriate skincare. Let's take a look at the most common secondary skin lesions. Now, let's look at tertiary skin lesions. These lesions are the final result of the healing process or long-term skin changes. They often indicate that the skin has repaired itself or that a condition has become chronic. Recognizing tertiary lesions helps us evaluate healing, identify possible complications, and provide appropriate skincare recommendations. Let's review the most common tertiary skin lesions. In real life, skin conditions rarely present with just one type of lesion. Most conditions involve a combination of primary, secondary, and sometimes tertiary lesions. That's why it's important to evaluate the skin as a whole rather than focusing on a single lesion. Let's look at a few common examples. Before we move on, let's review some of the most common dermatology terms. These terms help us accurately describe the appearance, size, shape, and type of skin lesions. Using the correct terminology improves communication with other professionals, supports accurate documentation, and helps us provide safe and effective skincare. When evaluating a skin lesion, it's important to observe several key characteristics. These include the location, size, shape, color, evaluation, surface, borders, and distribution of the lesion. Carefully assessing these features helps us describe skin lesions accurately, recognize abnormal changes, and determine when a client should be referred to a medical professional. Skin lesions often change over time, following a predictable pattern. Understanding this evolution helps estheticians recognize different stages of a lesion, monitor its progress, and decide when a referral may be necessary. In this example, we can see how an inflammatory lesion develops from an early papule to a pustule, then erosion, crust formation, healing, and finally post-inflammatory skin changes. Now let's begin with one of the most common skin conditions, acne vulgaris. Acne is a chronic inflammatory skin disorder that affects the pilosebaceous unit, which includes the hair follicle and sebaceous gland. It commonly appears during adolescence, but it can affect people of all ages. The severity of acne can range from mild to severe, depending on the type and number of lesions present. Acne can be classified into 4 grades based on its severity. Grade first is mild and mainly includes comedones with very few inflammatory lesions. Grade second is moderate with more papules and pustules. Grade third is severe with numerous inflammatory lesions and possible nodules. Grade fourth is very severe with extensive inflammation, multiple nodules, and a higher risk of scarring. Recognizing the severity of acne helps determine the most appropriate treatment and whether a medical referral is needed. Comedones are the earliest and most common acne lesions. They form when excess oil, dead skin cells, and debris block the hair follicle. There are 2 main types of comedones. Open comedones, also known as blackheads, have an open surface that becomes dark due to oxidation. Closed comedones, or whiteheads, remain covered by the skin and appear as small white or skin-colored bumps. Although they are non-inflammatory lesions, they can develop into inflamed acne if left untreated. Acne develops when multiple factors contribute to blockage and inflammation of the pilosebaceous unit. The main causes include excess sebum production, abnormal shedding of dead skin cells, the growth of Cutibacterium acnes bacteria, and inflammation. Hormonal changes, especially during puberty, can increase oil production and make acne worse. Genetics, certain medications, stress, and lifestyle factors may also contribute. Understanding these causes help us choose the most appropriate treatment and prevention strategies. Inflammatory acne lesions develop when blocked follicles become infected and inflamed. Unlike comedones, these lesions are usually red, swollen, and may be painful. There are four main types of inflammatory acne lesions. Papules are small, red, raised bumps without visible pus. Pustules are similar but contain a white or yellow center filled with pus. Nodules are larger, deeper, and more painful lesions that develop beneath the skin. Cysts are the most severe type. They are deep, pus-filled lesions that can cause significant inflammation and often lead to permanent scarring if not treated properly. Rosacea is a chronic inflammatory skin condition that mainly affects the central area of the face. It is characterized by persistent redness, visible blood vessels, and, in some cases, small papules and pustules. Rosacea typically affects adults between the age of 30 and 50 and is more common in people with fair skin. The condition may range from mild redness to more severe inflammation. Early recognition and proper management are important to help control symptoms and prevent progression. Although there is no cure for rosacea, appropriate treatment can effectively control symptoms, reduce flare-ups, and improve the overall appearance of the skin. Treatment focuses on reducing redness and inflammation, minimizing visible blood vessels, and preventing future flare-ups. Professional treatments may include gentle skincare, LED light therapy, and dermatologist-prescribed medication when necessary. Clients should also follow a consistent home care routine, use gentle skincare products, apply sunscreen daily, and avoid known triggers such as heat, spicy foods, alcohol, and stress. Talngiectasia refers to permanently dilated superficial blood vessels that become visible on the surface of the skin. They commonly appear on the cheeks, nose, and chin, and are often associated with rosacea, sun damage, or aging. Although they are usually harmless, they may be a cosmetic concern for many clients. Treatment options include laser or intense pulsed light therapy, while proper skincare and daily sun protection can help prevent further progression. Varicose veins are enlarged, twisted veins that most commonly appear in the legs. They develop when the valves inside the veins become weak or damaged, allowing blood to pull instead of flowing efficiently back to the heart. Common symptoms include visible bulging veins, itching, heaviness, swelling, and discomfort, especially after standing for long periods. As aestheticians, it is important to recognize varicose veins. Avoid applying deep pressure directly over the affected area, and refer clients to a medical professional when signs of pain, inflammation, or skin changes are present. This concludes part 1 of chapter 4. In this section, we reviewed skin lesions, acne, rosacea, Talngiectasia, and varicose veins. Understanding these conditions helps us recognize skin concerns, provide safe aesthetic care, and know when a medical referral is necessary. Thank you for watching, and I look forward to seeing you in part 2 of chapter 4. Thank you.